It seems like we see a new study every week about how coffee's good for you. Then the next week it says, nah, it's bad for you.
So we wanted to take the latest study that came out and verify if it's really true. The headline says something like 3 to 4 cups of coffee can have health benefits. Well, health reporter Rose Beltz takes a look at whether this is really true.
British Medical Journal researchers say coffee may not only give you a morning boost, it may also be associated with a bunch of other good stuff for you. So here's what it says. Drinking 3 to 4 cups of coffee a day could lower the risks associated with heart disease, stroke, metabolic and liver disorders, as well as overall chances of death when compared with not drinking coffee. So that sounds really great to me. I am always ready for another cup of the coffee experience, but I wanted to see and verify if that's true for you. So here are my sources up front. Dr. Abe Deanda, professor and chief of cardiovascular surgery at the University of Texas. John Roll, vice dean of research at Elson Ford College Medicine at Wazoo, and Dr. Bryden Curtis, interventional cardiologist at Providence Healthcare. Dr. Deanda confirmed the credibility of the British study. The data found was pulled from multiple studies, then refined using statistics. I then pulled in Dr. Roll to simplify how basic research is conducted. He says it all checks out. The data was pulled from multiple sources, then peer-reviewed, meaning the data found was reviewed by experts in the field before it was published. I wrapped up my own research with Dr. Curtis to find out how doctors are telling their patients about this. He says this study is very relevant given the large amounts of coffee and caffeine research that has been published over the last 10 years. But he says not all studies like this are a one-size-fits-all. For example, take women who drink more than 4 cups of coffee daily, then add the category of high risk of bone fractures with the heavy coffee. That means those women face a higher degree of injury. Dr. Curtis says studies are also rarely conducted on pregnant women, so they have to watch out for big blanket studies like this one. In this case, the mother feels the coffee benefits, but the developing child does not. Coffee is safe, but when you get into certain health conditions and genetics, it doesn't affect everyone the same. If you don't drink coffee, doctors are not recommending that you begin now. So we can verify 3 to 4 cups of coffee is considered a safe amount to drink. But what's unverified and still a question mark is whether doctors recommend drinking that much coffee for everyone. We still need more research on that. Rose Beltz with today's Verify for KREM 2 News.
Well, I'm taking that as
an okay.
I'm good. I don't need to quit it.
I don't drink a lot, but I do like maybe 2 cups in the morning, no more usually.
Me too.
Okay.